doesn't it rub you the wrong way to go into a doctor's office and you see somebody else come out of the office and they say, okay, you owe them X amount of money, and that person says okay and they pay, right? And you don't obviously hear that because you're supposed to stand a certain amount of distance back, but if you were listening in on the conversation, which you're not allowed to, but if you were, they would say, you would hear them say, okay, so that you saw the doc and it's going to cost this much, and so on and so forth. Which could be different depending on whether they have insurance and what kind of insurance they have and so on. But doesn't it bother you that they can tell that person how much it costs on their way out, and they're going to be able to tell you how much you're going to owe about an hour from now when you're walking out of that doctor's office, but they're not going to tell you right now before you walk into the doctor's office because they want a blank check. Now, I understand I already gave the reasoning for, oh, well, it depends on what the doc wants to do. I'm suggesting that they should actually have to tell you whenever there's just the base fee for the consultation with the doctor, and if they're going to do anything else that's going to raise that cost at all, they should have to come in and say, we want to do the following thing that's going to add an amount of cost. Here's the amount that it's going to add to the cost. So you're going to have the consultation is going to be this much. Then they say, we want to do this. That's going to add this amount of money in addition. And then they say, we want to do this as well. This is also going to add this much in addition. And if you don't sign it, then you don't owe it. They also don't do it, but you don't owe it. And if they do it, and they didn't get your signature first, and you don't sign, then you don't owe it. So I'm telling you right now that as soon as people actually see the price tags for this, that, and the other thing, and they start denying service based on that costing too much, and they go someplace else, these imaging centers, these x-rays, blood work places, these doctors' offices, and really everything in the healthcare industry, when you start shopping around, when you actually start saying, hang on a second, before we do that, I'm going to go shop around to see who offers this at a good quality for a fair price. As soon as that happens, that's competition. That's going to drive the price down. These places that are allowed to get away with charging too much, they're going to realize, oh wait, no, we're losing business because people are saying, oh wait, I can just get those people over there to do it instead, and it's way cheaper. These places are going to be forced to either become more efficient and lower their prices, or go out of business. And really, that's what needs to happen. Competition needs to be instituted, because you can see now how there's a lack of competition, because when you think about it, let's say you go in to get something done at a doctor's office, or one of these other places that runs the tests, or the treatment. If the doctor doesn't do the treatment, maybe you're going to get a treatment, and you say, hey, I need the following treatment, and they say, okay, well, it's going to cost this much. Well, or actually, under the current system, they would not tell you how much this is going to cost. And so if you agree to that under the current system, then you would get whatever it is done, and then it might come out being way more expensive than you wanted it to be. And then when you say, well, this is way more than I wanted it to be, okay, but you already had it done. You were sick, but you ended up paying too much. But now you can't say, wait a minute, I think that I paid too much. Let me go someplace else. Because you already got the opinion, you already got the test run, you already got the, however far you are along in the process, you're never going to get the opinion and then go get another opinion because you're hoping that the second opinion is going to be cheaper because you still owe for the first opinion, right? And if you go get the tests run, you're never going to go, oh, those tests were too expensive, let me go pay more money for a second round of tests, right? And then with the treatment, you might get the treatment done, and then you might say, oh, well, that treatment was way too expensive. What are you going to go get a treatment again? You know, I mean, you've already done the treatment. You've already had the the chemo or the pills or the antibiotics. But you're gonna go take a second round of antibiotics just because you felt like the first one was too expensive? That doesn't get you the money back for the first round, right? Clearly. So, because the current system is set up this way, you already owe the money for what they already do, whatever they're going to do first, right? And then you owe the money because you already agreed. So how are you supposed to say, oh, that was too expensive? How are you? It discourages competition. It almost prevents it, right? Because there can't be any competition because you don't know how much it's going to cost. It's just a question mark in the sky. It's going to cost this much, and that's unacceptable, I think, and I think that's what's driving up these prices. So let's talk about healthcare. How does the healthcare system work? Well, in the past, it was it's basically shared risk management is what it is. So the concept is that you're going to have all of these people, and they're all going to pay money into this pot, right? And then when one of them that pays into the pot gets sick, that person gets to dip their hand in the pot because healthcare in America is very expensive. And so this person is going to be allowed to dip their hand in the pot, and they're going to be able to use the money that's in the pot being paid into by all these people who are not sick, and they're going to be able to say, okay, well, it's my turn, I got sick, so I'm going to go use this money to go pay the doctor. And that's basically what it's supposed to be. And then as you are no longer sick afterward, you had your turn, but you're going to keep paying money into the pot, just as all of these other people are going to be paying money into the pot. And this is just going to keep happening. And, whenever one of them gets sick, now it's your turn, and you get to dip the money you dip your hand into the pot to pull out the money for what you need to pay for your health care. And of course, it gets more complicated than that based on the contract that you have from the health insurance company. And the health insurance company, depending on how much money you want to pay into the pot per month, right, which is your healthcare premium, it determines what kind of benefits you are entitled to. So if you pay more money into the pot, then you want to go see your primary care physician. Okay, well, it's $5, as opposed to maybe you have to dig into your deductible. Your deductible is where you say, well, okay, let's say you've got a $2,000 deductible, all right? So maybe your healthcare plan works something like this. Maybe it says, okay, you pay $150 a month, and if you get sick, something happens, you break your leg, whatever, then you owe the first $2,000 worth of medical bills per year. So here you are paying, $150 a month in to have access to this plan, and then when you actually have a problem, if your problem costs less than $2,000, you might owe, if it costs $500 to fix your problem, you might owe all $500. But the point is, when you hit that $2,000 cap, now it's all covered at 100%. That is an example of a healthcare plan. Obviously, it gets way more complicated than that. That's just one example of how healthcare might work. Like I said, if you want to pay more, then they might say, oh, well, okay, seeing your primary care physician is $5, seeing a specialist is $20, as opposed to you having to actually pay their full consultation fee. So it's just going to be $5 to see your PCP, primary care physician. He might charge, $150, or if you go see a specialist, she might charge, $400 for a consultation, and because they're a specialist, and your healthcare plan might get $20. You might say, oh well, I just have a $20 copay. Now you don't have to pay $400. You pay $20. And that $2,000 going towards that, you might, if you pay more per month, rather than $150 a month, you're paying maybe $200 a month. Maybe they'll cover all of the expenses going towards that $2,000 up to a 90% rate. You know, so you would actually you would have to spend $2,000 times 10, so effectively it would come out to about $20,000 worth of medical fees before you actually even hit the $2,000 mark in terms of what you've had to pay. You know, so that can cut down the rate that you have to pay a lot as well. So obviously, you know, I mean, they're contracts. You know, a contract can do anything. It's just an agreement written on a sheet of paper. But another thing that's interesting is what we could do in this country is you could just buy access to a healthcare plan that doesn't actually pay anything, ever. This is an interesting idea that I thought of. And what that is it means that you're not going to go to a doctor that's not in network. So, you know, let's say you have, I don't know, Blue Cross Blue Shield or something. And, you know, so you're going to go to only doctors that accept Blue Cross Blue Shield. So every time you go to a doctor, you say, hey, do you accept this insurance? And they say, oh yeah, I take Blue Cross. You say, okay, great. And, you know, you would think normally the way healthcare is expected to work is that it's going to help you pay for something. And this will help you pay for something, but not in the way that a lot of people think that it will. So whereas a doctor might say, oh, you know, here's the consultation fee, and then here's all the fees that we talked about, right? For who knows what, right? Well, what a healthcare plan does is supposedly they've got all these experts. You know, how expert these people are, I don't know. I'm not one of them. I haven't met these people. I don't know. But supposedly they have all these people that make these determinations on what the maximum allowable amount is for whatever that service that the medical profession is giving you. So whereas the doctor might say, oh, you know, my consultation fee is, like I said, $400. Well, if the health insurance company that you have, in this case we gave the example Blue Cross, says, no, your consultation fee is not worth $400, your consultation fee is worth $120, then that doctor has a contract with Blue Cross Blue Shield. And when they have a contract with Blue Cross Blue Shield, that means that the doctor is willing to accept whatever the maximum allowable amount is determined by Blue Cross. So whereas if you were a cash-paying patient, then yes, you would owe the $400 because you signed that paperwork that says, yeah, I owe whatever you say. And, but, you know, if you have this health insurance, then you don't owe the $400. Instead, because the doctor has the contract with your health insurance company, now the amount that you owe is whatever the maximum allowable amount by that company is. So it's a good idea to have health insurance, even if the health insurance isn't going to cover anything, because let's say, you know, the health insurance company, like I said, says, oh, your maximum allowable amount for your consultation is $120, not $400. Well, if you were a cash patient, you would have been paying $400. If you have this health insurance, then you would be paying $120, right? But that's not the health insurance company actually paying anything. That's, you have to pay everything. That's even with you paying everything, you know, you at least get this discount of them saying, well, hang on, it's not reasonable to charge $400, and the doc, you know, signed a contract that says, all right, you know, if you have this health insurance, then I'll agree to that. So then if you have health insurance, it goes above and beyond that and says, okay, well, it's not going to be $120. That's what the doctor charged us. So the doctor wants to charge $400, but because you have health insurance, it's going to be $120, and you're not going to have to pay $120. You're going to have to pay, if you have a $20 copay for this, specialist, then it would be $20 for you. But even if the health insurance doesn't cover anything at all, just having the health insurance basically tell the doctor's offices, hey, wait a minute, no, you can't charge that much. You can only charge this much. That service right there is worth something.